Names so infamous and so abhorrent. Beverly Allett, a staff nurse on a paediatric ward at Grantham and Kesteven General Hospital. She injured or killed 13 of the children in her care between February and April 1991. Harold Shipman, the Hyde GP who in 2000 was convicted of killing 15 of his patients, but was thought to have murdered more than 200 over a period of 20 years. And more recently, Victorino Chua, a nurse found guilty in 2015 of murdering 2 patients and harming 19 others at Stepping Hill Hospital in Greater Manchester. Now there is Lucy Letby, a nurse who cared for the sickest of babies. And like Allett, Shipman and Chua, she used that position to target, to kill those she was meant to help heal. Inevitably, questions will be asked about how and why. The grieving parents will want to know, the public will want to know. What makes a nurse become a serial killer?
They all are motivated by a desire to have power and control. And a power and control which for them they feel has been denied to them in other aspects of their lives. And it's within their professional lives where they have access to vulnerable people that they can exercise this egregious power and control which makes them feel superhuman.
In a study he co-authored, Professor Wilson identified 22 red flags to spot a killer nurse, including a higher incidence of death on shift, a history of mental instability and/or depression, and making colleagues anxious. Professor Wilson says Letby appears to be an outlier. The only flag raised was a spike in deaths while she was on the ward.
Most of the nurses who were killing in a healthcare setting were caught very quickly. 3 months, an average of 3 months. And the fact that Letby was, as has been described as beige, is perhaps one of the reasons why she was able to continue for as long as she did. The charges that she's been found guilty of took place over a 12-month period before those red flags set alarm bells off.
Following the Allett killings, there was the Clothier inquiry, set up to determine what could and should have been done to prevent a serial killer in a hospital.
We must be prepared to think the unthinkable. Whenever a patient's condition cannot be medically accounted for, a member of staff might be responsible.
And after Shipman, Dame Janet Smith chaired a wide-ranging inquiry, 6 reports containing around 200 recommendations. And yet, here we are again. So do we need still more regulations?
No, I don't think we do. I mean, I think all the reports are there and they've all referred, I mean, they're all different events, but they all come back to one central theme. It's the culture of the organisation. Now, the culture grows up over years. It's very difficult to change it, but you can change the environment within which people work. You can make it okay to say, I don't think this is right. You can make it okay to say, I'm worried about this person I'm working with, but that is a big leap for people to do that.
And of course, we now know the hospital delayed calling the police despite months of warnings over Letby.
The moment you've got some kind of circumstantial evidence to stack this up as a proper complaint and not just somebody having a go at a work colleague, then you have to call the police. And most big hospitals will have a liaison officer who works with the local police station, and you call them in and you sit them down and you say, look, we've got a bit of a problem. This is what it's looking like. What do you think?
Now the government has announced an independent inquiry into the circumstances behind the murders and attempted murders. So what would this inquiry be able to recommend that hasn't already been recommended?
I could write the inquiry now. It'll be a big list of things that went wrong. It'll be a lot of condemnation for the individual. It'll be a criticism of the managers, and somewhere in it all it will say the culture of this hospital has to change. I could write it now.
From angel to angel of death, a healthcare worker turned murderer, and yet it is a rare event.
My grandson was born over 2 months prematurely, just after Letby's trial started. And so, of course, never mind my academic research, I was watching nurses within a neonatal unit working with a wee baby who was fighting for his life. And I think now I would prefer to think about them rather than Lucy Letby, who is an outlier to the research, thank God, because most nurses don't kill, they save lives.
But for the families, it doesn't matter how rare an event nor how many of the staff on that neonatal unit did what they were supposed to do. Letby went onto that ward and murdered their babies.
Dr. Bill Kirkup has led a number of independent reviews into NHS failings, most recently the baby death scandal in East Kent hospitals. I spoke to him earlier today and asked for his reaction to the ordering of an inquiry.
I think it's absolutely essential. These are just awful events. We have to learn from them. We have to get better at detecting these kind of things much more quickly. I mean, prevention would be ideal, of course, if we could do that, but at the very least, we have to get better at spotting them rapidly. And the first way to do that is to monitor outcomes as they happen. And we could have picked this up much, much sooner than we did.
Because, I mean, doctors did that, but in their own internal way, I suppose, when they tried to raise the alarm.
They did. They had a feeling that there was something wrong here because of the frequency that these things were happening at. And they were right. But it's hard to persuade other people unless you have the concrete evidence to base it on. Now, if they'd been able to say, look, this is a proper analysis week by week of these events as they happen, and this is so far off the scale, we have to have a serious problem here. We have to put the resources into finding out what this is now, and we have to start thinking the unthinkable too.
Are you shocked by the reaction of the hospital management?
It's so disappointing that clinicians were raising concerns and were saying we think there's something wrong here, and they do not appear to have been taken seriously by those running the unit. That's very, very disappointing.
Do you think there is a more fundamental problem then about the relationship between doctors and management? I mean, there seems to be a sort of fundamental lack of trust in this case.
Yes, I think unfortunately that can be the case in some places. Hopefully not the majority, but I think in some cases it is. And I think when very drastic events like these happen, that can put a system under such strain that those cracks turn into gaping chasms.
As somebody who's done an inquiry and came up with recommendations, I mean, you've just cited one thing that could make this much easier to detect, which hasn't yet been done. So how do you do an inquiry that will be listened to and acted upon?
Yeah, you have to persuade people that these are serious problems and that they can get better if we do it. And we have. It took a little while to get going after the independent investigation into East Kent. The initial reaction was disappointing, and I said so at the time. But since then, we have begun to make real progress on introducing a system that does monitor outcomes, what the results of care are, on a case-by-case basis. And if we'd had that in the Countess of Chester Hospital, I've got no doubt that we could have picked up that this was way off the scale much, much sooner than happened.
Given that this will have ramifications for many patients in the NHS and parents who are in neonatal units, and do you think an inquiry like this should be held in public?
I think that there should be public involvement in the investigation. At the moment, I would call it an investigation rather than an inquiry, but that does depend on what the final format of the thing is. And there are ways to do that without, again, necessarily pushing everybody into the position where they have to be legally represented. We did that in the Morecambe Bay investigation, for example. We had representatives of families attended all of the meetings that we had and attended all of, or at least they had the ability to attend all of the interviews that we did. That's a way of discharging that obligation to be transparent and to have the families concerned assured that these things are being taken properly without, again, pushing this to go down a very legal route that does complicate the issues enormously.
Dr. Kirkup, thank you very much indeed.
Thank you.